So yeah, this is a great article, and it has implications beyond its own text. So, a good article, just like a good article or a good book isn't simply the text of that book or article. It should have implications beyond itself. And this article definitely does. So I think that's all I want to say about this. Hope you're all doing well. And I'm going to have to do quite a bit of cleanup of this video because of all the background noise that I had, which is obviously gone now. But apparently they decided to vacuum the hall in the middle of my recording. So we had background noise to my left, we've had background noise to my right, and then we have this visual background noise behind me that's just pathetic. I don't even know why anybody would buy that. I don't know why anybody would make it. I don't know why anybody would make it, share it, sell it, buy it, and then put it on a wall. That's just nasty. Hope you're all doing well. Take care, and I'll clean up these videos and get it to you as soon as I can. Take care. Bye.
I'm an old soul, got a funky sound. Gonna sing a song, turn the world around. I want that ass, you know I got the moves. Spank that ass, I'm gonna make you move. I ain't no player, I'm just here to shake. Hump that ass, no time for heartbreak.
What's going on, everybody? Dr. Vasquez here, coming to you live. I'm always coming to you live. And right now, we're going to talk about this vitamin D article that was just published earlier this year in 2025. But here's the deal. I'm going to talk about this article on vitamin D and autism, kind of ignoring vitamin D and autism. So the interest that I have in this article, I'm not surprised by what they found here, but we're going to talk about it anyway. And it's still important. What they found is important. But what I think, at least for me, what's more interesting about this article is to talk about the intellectual structure and the implications of this article. To me, that's more interesting. So, anybody can read this article. I sent it out earlier today to everybody on my list, inviting everybody to read the article. If you're interested in this topic, if you're, working with autistic kids or whatever, it's a good article. It's a very important article. It could help defend you in court if you ever get taken to court for treating autistic kids or whatever. So it's an important article. So I'm going to review it for its face value, let's say. But again, the interest that I have in this article is that it's important for other reasons. And I'm not saying that it's a perfect article. I'm going to show you what they did wrong. And I'll show you what they did right. So, I'm not going to complain about this article. I've got other things I can complain about. But, the purpose of this article, review of this article, purpose of this isn't to complain about it. It's great. It's wonderful. Let's all be happy. And the fact is, I'm a pretty good critical reader, and so even a good article like this is loaded with mistakes. So I'll show you what they did right and what they did wrong and what they could have done a lot better. So that's the interest that I have in this. Like I said, anybody can read this article, but not everybody can criticize this article. And so, Nietzsche said, this is one of my favorite Nietzsche quotes, but Nietzsche said, I contradict as no one has ever contradicted, but I am nonetheless the opposite of a negative spirit. So, I'm not trying to analyze this and say, oh, well, I'm smarter than they are, or I'm better. That's not the purpose. I could do this video and send it to them and say, hey, you did a great job, but you could do a better job next time. Whatever. But again, I'm not trying to do this to be critical. I'm just doing this because it's a good exercise for me and I like doing stuff like this. So without too much further ado, as everybody says, I'll dive into this. I'm going to have some background noise just because I'm in an urban setting right now, and it's just traffic, and the doors and windows are well made, but they're not well sealed. And so, what's the point in putting a double pane window in a door that's doesn't have a good gasket on it? It just doesn't work. So you're going to hear some background noise. It's just cars. The other thing in my background you may have noticed is this piece of art. Some of you might not know who the artist is who did this, and that's because no one cares who did this, and no one's ever going to know because it's junk. Right? Look at that. I can't believe somebody actually put that there. Obviously I'm not in my own place right now, but the fact that somebody made that, thought it was worth sharing, thought it was worth getting paid for, and then somebody else thought it was worth buying. That is one of the most abhorrent pieces of, I can't even call it art. That's just a stain on a piece of paper. So, background noise outside, and this is like background noise in a visual format on top of my head. Anyway, let's talk about vitamin D. So, this is a clinical trial published in Lab Med Discovery 2025. Title of this article is Improved. Sorry, let me start my recording here on the other program. Title of this article is Improved Core Manifestations of Autism Following Supplementation with Vitamin D3 Loaded Nano Emulsion. So like I said, I'm just going to go through this. I'll show you some good things and bad things, but I'll make a quick list of things that they did well and things they did wrong, and how you can read beyond. A person could, or I can, or what I try to do when I read stuff is try to read beyond just reading it. Anybody, 15 years old who speaks English can read this article. They might not understand all the vocabulary, but they would be even less likely to be able to identify the errors and see where this could have gone farther, or what it means beyond the words, So the idea that I had for this is to call it meta reading. So meta just means beyond. And so, anybody can read this. Anybody 16 years old with a dictionary could read this article. But like I said, not everybody can read into it or read beyond it. So let's do that now. So here I am starting this at 6 minutes and roughly 30 seconds into my introduction. So let's just go with this. Again, improved core manifestations of autism following supplementation with D3. So again, let's look at what they did right. Let's look at what they did wrong. I'll look at the abstract right now. Sorry, there's something on here that I meant to take out, so I just took it out. I'll show you that later, but I didn't want to spill the beans before we get there. So I'll read most of the abstract right now, just so you know what they said and the importance of this. Like I said, I would call this a very important article for its direct implications. But I think the article could have been better and could have gone farther, and so that's what I want to talk about. So let me see if I can make this just a little bigger, since I'm focusing in on the abstract right now. It's going to take me a minute just because this program is a little bit difficult to use. Oh, that worked out pretty well. All right, so here we go with the abstract, and then I'll get into the good and bad of this. Children with autism spectrum disorder. That's kind of a dumb phrase if you think about it. So, all diseases are on a spectrum, so why do we need to call this autism spectrum disorder? And why not call it a disease? It's not a disorder. It's not like your room's messy and you need to put your room in order. Autism is a catastrophic disease. It's not a disorder. And we don't need to call it spectrum. That's kind of stupid. Everything is on a spectrum. Cancer is on a spectrum. Diabetes is on a spectrum. Being tall or short is on a spectrum. Being a good or bad waitress or waiter is on a spectrum. So why do we need to call this spectrum? That's just stupid. And I never thought of that before, but it occurs to me right now. But I think the reason that autism is called autism spectrum disorder is because the medical profession, which is obviously responsible for naming this as it is. It used to just be autism. Now it's autism spectrum disorder. That's just political bullshit. They're just trying to confuse the topic. So anyway, I said what I said. Children with autism, hold on a second. Just call it autism. I mean, being rich and poor is on a spectrum. So why don't we call it, you're on the poor spectrum, or you're on the rich spectrum, or you're on the whatever. I mean, it's just stupid. I guess pizza's on a spectrum too, for that matter. Maybe orange juice, whatever. Children with autism had lower D3 levels than neurotypical, we could just say normal, neurotypical children, as well as deficits in language, social, and fine motor abilities. Nanotechnology has appeared as a suitable answer to absorption and bioavailability problems related to D3. This study aims to investigate the influence of vitamin D3 loaded nano-emulsion supplementation on adaptive behavior and language performance in children with autism compared to the influence of the marketed, like a normal product, of vitamin D3. So in other words, more briefly, autistic kids have deficits in language, social, and motor categories, and now they're going to try to push vitamin D3 that's a nano-emulsion. So all fat-soluble nutrients like vitamin A, vitamin D, CoQ10, vitamin E, the vitamin E family, carotenoids, all of those fat-soluble nutrients experience some level of challenge for being absorbed because, first of all, they have to be consumed, then the food has to be masticated, broken down. Sometimes that includes dissolving the whatever might be around that food substance, whether it's fiber or, meat or whatever, collagen. And then the stomach would have to have sufficient hydrochloric acid to then activate the pancreas, for the pancreas to then excrete its enzymes. So you're looking at a couple different steps there already. None of that's going to work if the patient is zinc deficient, because zinc is necessary for taste, smell, production of hydrochloric acid, and production of pancreatic enzymes. So a lot of these kids, for example, so this is just an example of, like I said before, they did a good job here, but there are a lot of things were excluded from this conversation. And that's just to be efficient, and it's just to be expected as well. But a lot of these kids are zinc deficient. So if they had used vitamin D and zinc, they would have gotten much better results, presumably. But anyway, let's go on. But anyway, like I was saying, a lot of fat-soluble nutrients have a complex pathway of absorption. And so what they're saying here is that, hey, we made a vitamin D that can be better absorbed because it's already emulsified. Okay, great. Supplementation of autistic children. I mean, even being a child is on a spectrum. You've got little kids and then you've got older kids. So why don't we call it childhood spectrum, whatever. With an oral vitamin D loaded nano-emulsion was performed in group 1. So group 1 got the nano-emulsion, and the marketed or normal product was used in group 2 for 6 months. So I'm just going to keep reading the abstract, and then I'm going to highlight a few things that a good critical reader would identify in this and look for. So, I mean, I scanned over this article, and a few things I looked for that aren't mentioned in the abstract, and those are items of importance. So you'll see how that plays out. Like I said, anybody with a dictionary can read this article, but not everybody is going to be able to understand it, see what they did right, see what they did wrong, and see what the implications are that could take us kind of to the next level. So as I go through this, I'll make a few notes. All I have is this envelope to write on. I don't have my drawing pad with me, so I'm just going to take a few notes to make sure that everything gets included. So for 6 months, evaluation of their abilities and measuring plasma levels of 2 types of vitamin D3 were performed using ultra performance liquid chromatography before and after supplementation. Totally normal. So they're going to measure stuff before and after. 2 types of vitamin D3, that's a little bit weird, but whatever. Supplementation in group 1 that got the nano formula led to an elevation of levels of 25 hydroxy vitamin D and 125 dihydroxy vitamin D, forms of vitamin D3, behavioral improvement in the form of a reduction of autism severity, and a rise in the social IQ and language age of the children. So that's impressive. So the kids who got the nano vitamin D improved a lot. They had better neurologic and social function. That's pretty good. On the other hand, group 2 that got vitamin D in the normal format, meaning that it wasn't pre-emulsified, they did not show adaptive behavioral improvements. Conclusions. Vitamin D3 loaded nanoemulsion provided better vitamin D3 bioavailability and a true influence, should have said benefit, a true benefit on severity, adaptive behavior, fine motor abilities, and language performance, reflecting the desired benefits of the rise of vitamin D3 levels in blood. Okay, great. That's wonderful. Does anybody think that this is going to change the practice of pediatrics or medical psychiatry? Probably not. Almost certainly not. So, you know, for those of you who have been around medicine for years, like I have, you know that medicine doesn't change when it comes to nutrients. They're going to say, oh, well, you need more studies. Oh, well, this study was done, I believe, in Egypt. So we can't assume that that would be relevant for American kids. They come up with whatever bullshit they want to not advance, you know? So, I mean, this is a hugely important article, and it's mostly well done. I'm going to talk about what they could have done better, but it's still an important article. The medical profession, I'm talking mostly about in the United States, but it's true everywhere. Whatever the American medical world does, that just trickles down and disperses to other countries. So, I mean, you know, whatever happens in the U.S. becomes policy in most other countries. But they'll never pick up. I mean, they're not going to pick up on this within our lifetimes, I assume. Okay, so let's go down and look at some of the details. This is all just background. Mostly accurate. Let's get into the procedures. So again, this was overall a group of 80 kids, as far as I recall. And yeah, 80 kids. So half of them, 40 of them, got the nanoemulsion and the other group got vitamin D. So let's talk about the structure of this research and if it was appropriate for what they tried to find or tried to conclude. So they had 2 groups. I'm just going to make a note to myself, and maybe I'll take a picture of my own notes and I'll put it with the review or whatever. So I'm just writing down the word groups, or maybe I'll just, when I go back and edit this, I'll type it out into the screen so you can see it. So the groups were nano D and regular D. Is that appropriate for a study like this? Not really. I mean, it's pretty good. It's better than nothing. What they found is still important and should change the practice of medicine, yes. But they should have had another group that got no vitamin D. So basically, what they did here is they had, from a physiologic standpoint, what they had in the study was a high dose D and a low dose D, but they should have had a 0 D as well. That would have been a better design. The other thing, which should be, or is not, should have been mentioned here, but they didn't talk about the dose. They did talk about the duration. So whenever you look at a vitamin D study or any nutritional study, you have to look at dose and duration. And because these are kids, kids doesn't tell you anything. They just said children as far as I recall. A child is any human between the ages of 1 and 18 years of age. That's huge. I mean, so they have to define ages range here, they say, from 3 to 6 years. And they were not on medications or supplements for the past 3 months. Okay. But vitamin D is not dosed necessarily based on years. It's based on body size. So what they could have done and what they should have done is dose for size, not dose necessarily for age. That would have been a little better. So I'm writing down dose for size and weight, not age. So that would have made the study better. The other thing is, just talking about dosage. So in my article, The Paradigm Shift, that I published 21 years ago, what I said then was that kids, not infants, what I said is that, and this was too conservative, but what I said 21 years ago is that infants should get 1,000 international units, children should get 2,000, and adults should get 4,000. I mean, we could probably double all of that, but for the time, that was a reasonable thing to say, considering that nobody was using vitamin D back then, basically. What I'm looking for right now is what dose they used, and they talk about the concentration of it here, but that's not the dose. Let's see, I'll try to get clear on this. This is important. Like I said, they talk about the concentration there, but that's not the same as talking about the dose. I'll see if I think it was like 1,700 international units. I think that's what I had seen. But anyway, they have to get the dose right. If the dose isn't right, whether they use a standard formulation or a nano formulation or whatever, they're still going to have suboptimal results. And that's one of the ways that these vitamin D studies get sabotaged all the time, is they underdose. Well, if you underdose, it's obviously not going to work. The other thing, which I have mentioned, but I haven't fully commented on, is that the other major issue here is that of duration. And they said that they did this for 6 months. Is 6 months appropriate for a study like this? No, it's not. So duration is too short. Sure, they did this, and maybe they're going to publish another follow-up study. So they found what they found at 6 months. That's great, and it's quite excellent. Maybe they will maybe they will continue this and see what they find at 12 months or even 2 years. But sorry, I'm still looking for the dose of what they used. I may have to do an electronic search to find it, because I don't know why they just didn't list it right here, unless it's right in front of me, and that could happen. So let me do a quick search for international unit, or let me look for dose, and see if that gives me what I want. Yeah, both groups received oral drops, either emulsified or not, which is equivalent to 1,400 international units. Is 1,400 international units, is that the appropriate dose for this age group? No, it's not. So, again, 1,400 IUs per day. That is inadequate. So, the duration was inadequate. The dose is also inadequate. Therefore, the results will be less than what they could have been. So let's talk about this. They talk about how they prepared the emulsification. They used glycerol, that's okay. At least for me, it's okay. They used fructose. That's not really okay, but we're talking about a very small amount of that just to give it some sweetness so these kids will take it. It's not great. Almond, pumpkin, olive, and wheat germ oils were bought from the specific unit of extracting oils at the Authors Institute. Well, do autistic kids have a lot of allergies? Yeah, they do. Could they have allergies to extracted oils from almond, pumpkin, olive, and wheat germ? Hell yeah, they could have some allergies there. So, the other thing is, olive oil tends to be anti-inflammatory, and so theoretically that could have provided some extra benefit. Wheat germ oil is probably pro-inflammatory, either due to the potential allergens. I realize we're talking about microscopic or nanoscopic amounts, but I'm still talking about it. The wheat germ oil could have had some allergens, and it's mostly omega-6, so that would be pro-inflammatory. So, a few details like that they didn't probably talk about a lot. And then they say here, mango flavor was purchased from this company in Egypt. Well, I mean, if they already put fructose in it, why do they have to give it a mango flavor? I think that's unnecessary. And here's the other thing. So I looked up that company, Kamena, in Egypt. It's not like I did some hour-long search. I just Googled them and I didn't find anything. But I did find an article from the Journal of Food Science and Technology, and they talked about the creation of imitation mango flavor. This was published in, I don't know when it was. I thought they were going to say there, but maybe they say down here. This was published in 2022. And so look at this. Synthetic aroma to create artificial mango flavor can be subdivided by functional group into hydrocarbons, alcohols, aldehydes, ketones, acids, esters, oxides, lactones, and sulfur compounds. And then they say ketones, lactones, and alcohol and esters were provided by some company in China. The other aroma compounds from synthetic origin came from another company in China. So basically, they dosed these kids with very small amounts of synthetic mango flavor, presumably synthetic, which could have had a negative impact on these kids. If they already put fructose, like I said, you're only talking about a microscopic drop. Just put it in their food. In my opinion, the fructose may have had some pharmacologic benefit in the emulsification. I don't know. But I do read that as being unnecessary and potentially complicating, especially in a group of neuroinflamed kids famous for having food allergies and multiple sensitivities. I think the mango flavor was unnecessary and might... See, here's the deal. We could talk about food allergies from a classic standpoint, but what I would be more concerned about in these kids is disrupting their gut barrier or their blood-brain barrier, or just causing neuroinflammation via the non-specific activation of mast cells. And so I wouldn't have used any artificial chemicals for these kids, and I wouldn't have used wheat germ oil either. Like I said before, the dose was too low, so these doses are inadequate for this patient population, this age population, and for the duration of the study. So, yeah, they just underdosed it. So here we get into results here. I'm going to take that conversation to what I would call the next level in just a minute. I want to make sure that I remember to do that. So let's look at the results. I already talked about the results. So these kids improve socially, linguistically, and I believe they also said motor skills. That's pretty awesome. If we look at one of the charts here, if we look at this chart, this is important. This is very important. So let's look at this chart. It's already reasonably big. I guess I could make it a little bigger, as long as I can regain control. Well, obviously we have to look at these results. So the kids who got the nano vitamin D had their vitamin D levels raised from 43 to 105. So that's more than double nanograms per milliliter. So let's start that over again. I just had a disturbance outside, some background noise. So what we're going to do right now is look at this table 2 and look at the changes in serum results. So as I had started to say before the background noise became intolerable, in any vitamin D study, you have to look at before and after. You have to look at before and after to see if it worked at all and to what extent that it worked. And also, what was the baseline? So in any clinical intervention, what you're looking, in any clinical trial, I should say, in any clinical trial, you're trying to compare what happened. All right, so we just had our second major interruption with background noise, so I'll try to keep going. So I started to say that in any clinical trial, you're trying to compare two things together. But you're actually doing, it's a little bit complex. So in a controlled clinical trial, you're trying to compare the difference between two groups. Like, what was the difference in the outcome of these two groups based on the single difference being the intervention? But the other thing that you're looking for is within group change. So what we're looking for when we analyze a study, a controlled trial, is yes, you are looking for the difference between the groups. And in this study, the difference is significant. However, you also have to look at changes within the same group. So when we look at the vitamin D levels of the baseline levels, we see that the baseline level was 43 nanograms per milliliter, and they more than doubled to 105 nanograms per milliliter. Now, to interpret that, let's look at my graph, which I created 5 years ago, to talk about where these kids are and where they started. So again, going back to the study, they started at, again, using the units of nanograms per milliliter. They went from 43 to 105. So they were actually sufficient at the start of this study. Nanograms per milliliter. And again, let's go back, nanograms per milliliter. So they were already sufficient. Like in the United States, this is considered beyond adequate. And in most of Europe, and if you look at those imbeciles from the Endocrine Society, they would say that anything down here is okay. Even though you have osteomalacia, chronic pain, weakness, infections, more respiratory infections, acute respiratory distress syndrome, increased mortality. According to the Endocrine Society, all that's good stuff. So again, these kids were already doing pretty well. In fact, let's go back and look at it in a slightly different way. Again, they started at 43 nanograms per milliliter. Well, let's go back and look at my article from 2004. And our very conservative proposal back then was that the optimal range could start at 40 nanograms per milliliter. And using nanograms per milliliter, these kids are already what could kind of reasonably be considered optimal. So Did they improve with treatment? Oh yeah, they did. Their vitamin D level more than doubled. Did they improve better than the other group? Yeah, they did. But did the other group also improve? Yes. So again, this is an interesting study from a lot of different perspectives, but the ideal vitamin D study would be to take kids who are deficient and then make them optimal. These kids were already, and this is actually part of the paradigm shift of this article, is that they took kids who were normal with vitamin D status and they made them even better, according to my criteria, because I, and of course a few other people, have said that sometimes the optimal range might be higher. You know, I've said here, even though we're getting, super physiologic, doesn't necessarily mean that's bad. So these kids went from normal to super physiologic and they got better. So the old paradigm has been that you want to take people from deficiency to normal, and you'll see the good results there. This study took kids who were normal and made them super physiologic with vitamin D status, and that's where the magic happened. That's where they got the better results. So that is a paradigm shift in itself. Let's go back and look at, the other thing is, so with the within group difference was mathematically significant. Physiologically, it was obviously important because that's what provided the good result. But the paradigm shift of this particular article is that it is showing that super physiologic levels of vitamin D create clinically important benefits that you don't get with normal levels. This isn't bad. They took these kids. You'll notice also, again, you have to look at the comparison. Everything is relative here. So if it's relative, you also have to look at how things started and how things ended up. These kids were actually, importantly, better status. The kids in the supposedly active group were at 43. They were significantly lower than the other group at 52. And again, they went from 52 to 82 nanograms per milliliter. And again, here using nanograms per milliliter, they went from low optimal to high optimal. So, and they didn't get benefits. They did not get benefits. The kids who ended up here are the ones who got the benefits. That's pretty amazing. Receptive language within a period of 6 months advanced worth the equivalent of 1 year. Expressive language also advanced the equivalent of 1 year within 6 months. So obviously these kids are starting to make gains just based on giving them super physiologic levels of vitamin D. And total language improved by about 1 year as well. The kids who got the lower dose didn't have that level of improvement. Then the authors do a pretty good job, a commendable job actually, of discussing vitamin D. Vitamin D deficiency is common, we all know that. It's a neurosteroid, okay, that's fine. Vitamin D deficiency in pregnancy increases the risk of having a kid with autism, not autism spectrum disorder. Vitamin D, this is important, what I highlighted in green. Vitamin D could influence cognitive development through its anti-inflammatory action and by enhancing the serotonin pathway of tryptophan instead of kynurenine. Yeah, that's great. I mean, they can and they do go farther than that, but that's a reasonable statement. We're talking about dopamine. All that's great. So in the article that I've already provided online, you can obviously download this article and read it for yourself and get those details. They did a good job of the review. But, so let's go back because I do want to make another point. Here they talk about brain neurotransmitters. Oh, that's great. Let me make the page smaller. Then they talk about the antioxidant benefit to vitamin D. That's great. Immune system. So now we're going beyond biochemistry at this point. serotonin. I like their comment here, which I made my comment on this, which I'll show you in just a minute. I made my comment on this just from kind of overviewing the article, and then I found that they used the exact same language that I did, which is wiring. So that's good. I'll show you that in just a minute. Here they're still talking about biochemistry, so that's okay, but it's all boring. This is all pharmacology here. So I guess I want to get to this point right here, because this is actually, hopefully, the point that I wanted to make earlier. Children with autism, finally they said autism instead of autism spectrum disorder. Children with autism have been reported to have gastrointestinal and sensory processing disorders, particularly those involving taste and smell. Okay, that's not what I'm looking for, but it was on the right theme anyway. So, okay, so here they talk about gut again. So they're talking about reduced food intake, reduced sun exposure, increased demands, or disorders that those children could manifest in the gastrointestinal tract. Wow, they actually said this. Inflammation and intestinal lymphoid nodular hyperplasia. I want to see who they cited. I wonder if it's Andrew Wakefield. Wow, that's interesting. Let's see what their citation is for number 56. No, not Wakefield. Gastrointestinal conditions in children with autism spectrum disorder. I think Wakefield was one of the first to discover that. But then, of course, he got blacklisted for talking about how vaccines could cause that problem. Okay, so I'm going to read their conclusions, and then I'll close this out. But I do want to mention something else that's very important. Supplementation of children with autism using the prepared vitamin D3 loaded nanoemulsion has led to a reduction in the severity of autism and a rise in the social IQ, especially fine motor performance and language abilities of children with autism, without any adverse effects. On the contrary, the marketed product, which is like the normal vitamin D, did not show any significant reduction in the severity of ASD, autism, or a rise in social or language abilities despite elevation in blood level. We emphasized that the vitamin D3 loaded nanoemulsion provided an effective and true influence on the adaptive behavior and language abilities of children with ASD, not only on the rise of vitamin D3 levels in the blood. So what they're saying is that it didn't simply give them more vitamin D, but it actually changed their neurologic function. Yeah, that's great. That's great. So we'll take all of that. What I said, I'm just going to try to move this document just so I can get the title back on the page. What I had said 21 years ago, remember what they said here about the dose. Let's go look at the dose one more time. Yeah, 1,400 international units. Remember what I said 21 years ago is that kids of this age should get 2,000. Nonetheless, it did work for them. But part of the reason it worked for them is the kids weren't deficient to start with. So I'm going to close this article and then we'll go back to the article we're looking at. None of these kids were deficient. So they didn't take these kids from deficiency to sufficiency, which is usually the goal. They took these kids from sufficiency. These kids were doing great, and they were in the control group. This is not deficiency to sufficiency, which is what most studies look at. This is normal to supraphysiologic. Huge difference, huge difference. I mean, most endocrinologists at this point would be wetting their pants. They'd be crying in the corner saying, oh, your kid's vitamin D toxic. Well, apparently not. They didn't have any negative effects here. People do not get toxic, so-called toxic, with vitamin D just because of the vitamin D level. Vitamin D itself is not toxic. The toxicity of vitamin D3 is mediated through hypercalcemia. So if they're not hypercalcemic, then they're not toxic. Let's look at this. So their 125 dihydroxy vitamin D also increased from 44 to 68, and from here to from 53 to 67. It doesn't really matter that much. Like I've said many times before, the action of improved vitamin D status comes from 25 hydroxy vitamin D3, not 125 dihydroxy vitamin D3. So, this form, let's look at the change here. I mean, the difference in the groups between 68 and 67, I mean, that's mathematically and physiologically insignificant. It doesn't matter. So that's not where the action occurred. So in a sense, this can be interpreted as, again, showing what I've stated before, and that is that the physiologically important form of vitamin D3 is 25 hydroxy vitamin D3. So you can see here, this is where the action happened. The action did not happen here, but I guess they measured it just to be safe or whatever, or show that it was safe. So again, the study is good, the discussion is good, and now let's see if I can take the conversation farther than maybe they did. And to be truly critical, let's see. So here they talk about some stuff going on in the gut. That's what I want to talk about now. So at least they mentioned it. But here's the deal. They looked at one nutrient compared to itself, basically, the only difference being the form of the nutrient. So, like I said, a slightly better study design would have been emulsified vitamin D, normal vitamin D, and then no vitamin D. However, even better than that, of course, would have been looking at multiple nutritional interventions at the same time. So they only did one intervention here, and they got great results, great. And they got super physiologic levels of vitamin D because the kids were already normal. They just took them to either high normal or super physiologic. That's interesting. But the other two implications are that these kids have a general malabsorption. They don't have a selective malabsorption of vitamin D. So they're also deficient in vitamin A. They're also deficient in anti-inflammatory and antioxidant and immune-regulating polyphenolics and carotenoids and other accessory nutrients like CoQ10, luteolin, lutein. I mean, if you look at these kids, you will find multiple nutritional deficiencies. In this study, they only corrected one of those, and they still got great results. So if these kids, indirectly, this research also shows that these kids have nutrient malabsorption. Is it selective? No. Is it specific to vitamin D by itself? No, of course it's not. Is it specific to fat-soluble nutrients only? Probably not. So what about B6, B1, riboflavin, magnesium, zinc, selenium, things like that? Would you expect these kids to also have other deficiencies across the board? Yeah, you would. Again, they only corrected one here. But, so what they showed is vitamin D malabsorption, because basically by bypassing that vitamin D malabsorption, they got great results. Wonderful. That's great. You could stop there and that would be enough. You could also then extend what you, here's where I'm getting into what I called earlier meta-reading. You could also extend the probability of what's going on here and say, well, it's probably not selective to vitamin D. They're probably deficient in other fat-soluble nutrients as well, of which we could easily name, probably 10 or 20. We could easily name 10 or 20 other fat-soluble nutrients that also affect immune and neurologic function. So the fact that they found, one clear finding implies that if they had looked, they would have found a lot of others. Not simply for fat-soluble nutrients, but probably for other vitamins and minerals as well. Why would these kids have non-specific, widespread nutrient malabsorption? Well, the answer is pretty obvious. It's, among the answers that we could state, the most obvious is that these kids have dysbiosis. I've talked about that before. I wrote a book on it a couple years ago. I've done videos on it. So all these kids have dysbiosis, basically. And dysbiosis typically causes gut inflammation. That typically causes gut damage. That typically causes nutrient malabsorption and maldigestion at the microscopic level in the wall of the intestine, due to the, for example, inhibition of intestinal proteases through the activity, disaccharidases through the activity of the proteases of the bacteria. So, yeah, we've been there for 30 years. So the kids have dysbiosis. That's causing the gut inflammation and gut damage. That's leading to nutrient malabsorption, which is then contributing to their neuroinflammation and leading to some of their symptoms. So, actually, I'll look for an article that I wrote on that back in 2006. Let's look at something. Let's look at it right now. I may have to blur out the screen just for a moment. But let's look at an article that I wrote. Here it is. Let's look at an article I wrote and published 19 years ago. The same year that I started medical school. So I said something in this article about autism, which I think has proven itself over time. Let's just see if that's correct. I do talk about autism somewhere in here. Maybe it's in the neurologic section. I may have to do a search for it just to find it faster. But I had a pretty good quote about autism in this article. Yeah, I think it's here. Yeah, so let's look at what I say here. Autism is not a behavioral disorder per se. Rather, it is a gastrointestinal, allergic, immunological, toxicant, nutritional, environmental disorder. And the behavioral cognitive abnormalities are symptoms of the underlying complex and interconnected pathophysiology. Yeah. So, the tragedy, among many tragedies in the medical world, is that they try to treat everything, they don't. They don't actually try to treat everything. They try to, manage the symptoms and let the underlying disease perpetuate, because that's more profitable. If they actually treated the complexity of the disease, then they would cure it, and then these kids wouldn't need, decades of behavioral therapy and drugs and whatever else. So I think by now, even if you're looking at really basic conditions like obesity and diabetes and hypertension, by now I think we're all aware that the medical profession has absolutely no interest in curing anything. They want everything to be thought of as a genetic disease, and they want all the treatments to be suppressive but not curative. And so they are obviously financially interested in, and politically interested in, keeping everything mysterious. They don't want to actually solve a problem. They just want a Band-Aid over everything forever, because that's more profitable. And the same is obviously true for these kids suffering from autism. So I think that's all I want to say. Very important study. If you just read the study, it's important for what it is. If you look at a few of the details that I looked at and talked about, I think that makes it even more important. I mean, this study shows that taking kids from normal vitamin D status to superphysiologic, or at least high level of the higher end of the physiologic range, that's what created the difference here. These kids were not deficient going from deficient to normal, which is what you see in most studies. These kids were normal and they went super physiologic, and that made a huge difference. And even if you look at the difference between groups, the intergroup difference, they're comparing normal with super physiologic and normal with pretty darn optimal here. So even then the difference isn't that big, but look at the difference in the clinical outcomes. It was massive. So this article deserves to be a paradigm shift. It reinforced what we already know, that these kids have gut involvement, which means they have to treat the gut, which they also show that they didn't show this, but the implication is that if you've got a fat-soluble malabsorption, it's probably not exclusive to one nutrient. It probably involves others, and if that's true, then you could probably be looking at minerals and water-soluble nutrients as well. So you got to treat the gut in these kids along with giving them easily absorbable forms of nutrients, but also, pretty high doses to force it in. You got to force it into their gut. You got to force it into their cells. You got to force it past the blood-brain barrier that's not working appropriately. So yeah, this is a great article, and it has implications beyond its own text. So, a good article, just like a good article or a good book isn't simply the text of that book or article. It should have implications beyond itself. And this article definitely does. So I think that's all I want to say about this. Hope you're all doing well. And I'm going to have to do quite a bit of cleanup of this video because of all the background noise that I had, which is obviously gone now. But apparently they decided to vacuum the hall in the middle of my recording. So we had background noise to my left, we've had background noise to my right, and then we have this visual background noise behind me that's just pathetic. I don't even know why anybody would buy that. I don't know why anybody would make it. I don't know why anybody would make it, share it, sell it, buy it, and then put it on a wall. That's just nasty. Hope you're all doing well. Take care, and I'll clean up these videos and get it to you as soon as I can. Take care. Bye.
I'm an old soul, got a funky sound. Gonna sing a song, turn the world around. I want that ass, I got the moves. Spank that ass, I'm gonna make you blue. I ain't no player, I'm just here to shake. Hop that ass, no time